Today we are putting a spotlight on arthritis, and I've entitled my presentation to read Reducing the Impact of Arthritis and Other Musculoskeletal Conditions, because I'm assuming that the participants may not be having arthritis, but they could participate in the process of reduction of the impact of arthritis and musculoskeletal conditions, not only in their families, but in the country and in the world. So we will, this is a brief outline of the presentation. We will look at musculoskeletal, we'll define musculoskeletal diseases and look at the agenda that those of us in this area of musculoskeletal diseases, what agenda do we have? I'll give you an outline on the burden of musculoskeletal conditions so that we know what are they, why are we talking about them, what is their impact, and we'll mention, we'll put a spotlight on a few conditions, then the prevalence of the problem, effects of the conditions, what do they mean in terms of cost, and what does the future hold, and how can we prevent them if possible. So basically, there's a book which was produced by the WHO manual, a report by WHO, which outlines many of these things we are talking about on the burden of musculoskeletal conditions at the start of the millennium, when they declared the millennium. And that's the time they declared the bone and joint decade. And they defined the conditions and diseases that affect the muscles, the bones, joints, and connective tissues. So the agenda that was set by then in 1999, because the decade started in 2000 with the late Kofi Annan, that these conditions are a major cause of morbidity throughout the world. And these diseases have a substantial influence on health and quality of life, and they inflict on an enormous cost on health system. And therefore, the UN say that with increasing number of older people and changes in lifestyle occurring throughout the world, this trend will increase dramatically over the next decade and beyond. And we must act on them now. So I'm trying to say that one of the issues that is leading to the increase and impact of this condition is our lifestyle. And secondly, the increasing number of older people. And these areas, we need to start identifying where are the areas where we can intervene and slow down the tide of the musculoskeletal conditions. Why are we talking about them? Because these conditions are the leading cause of pain. If you find anybody in pain, most of them have got musculoskeletal pain, and they are the leading cause of disability. Most of the people who claim disability are because of musculoskeletal diseases, back pain, whatever it is. The leading cause of absenteeism from work. Of course, the leading cause of absenteeism from work is usually respiratory infections, but those are minor issues. But the actual leading cause of absenteeism from work are musculoskeletal conditions. And also, they're the leading cause of early retirement. And I'm happy that this condition, this function is hosted by APA, an insurance company. And many a time, the insurance companies put these conditions under exclusion, but it is not proper to cover medical conditions and pick on the leading cause of pain, the leading cause of absenteeism, the leading cause of retirement, and then you put it under the commonest condition in the society, and then you say, I'm not covering that one. It's like leaving the people you have covered there without any cover. So musculoskeletal pain and disability affects 20% of adults have pain at any point in time. Like now, if you take all the adults in the world, 20% of them have got musculoskeletal pain as we are speaking. And musculoskeletal pain limits everyday activities in 25% of those ones with the pain. And the musculoskeletal pain is often a long-standing. They are usually long-standing. They are long-standing conditions, which the insurance company is called chronic. But even a long-standing condition has got an acute episode in between. And therefore, if you are covering me medical, you cannot say that if I've got something which affects me in health, you want me to pay premium and you don't want to cover it. No, you cover me in entirety so that my life is comfortable. So musculoskeletal pain can be very severe. And one of the severest pains is gout. And gout is much more common in men than women. It starts at around the age of 40, but we'll go into that. The other cause of severe pain is fracture. And I'm talking about fracture because accidents are also important cause of musculoskeletal conditions, road accidents. So the conditions that we will throw a spotlight on are the joint diseases we'll mention is just a spotlight on osteoarthritis, rheumatoid arthritis, gout, infections. Infections are also cause arthritis. Then back pain, musculoskeletal pain, osteoporosis and low trauma fractures, bone infections, trauma and injuries. So what is osteoarthritis? Osteoarthritis is just degeneration of cartilage of the joints. In fact, the joint fails because of loss of cartilage. There's pain and therefore loss of function. This is the commonest form of arthritis worldwide. Just second to back pain, but you know back pain is caused by many other things. And it is when most of the people you see walking around limping, walking with walking aids and all that, the joint has failed, and there's a reduction on joint. When you look at the loss of cartilage, as you can see depicted there in that surgical exposure of the knee, and the radiological exposure can show you X-ray that the joint surface, the joint space is reduced because of the loss of cartilage. So it commonly affects the knee joints, the hands. You can see some swelling on the hands there. We call them Haberden's nodes and Bouchard's nodes. It can affect the hip. It can commonly affect the neck, back, hip, hand, base of the thumb, the knees, and the first metatarsophalangeal joint of the toe. Those are the commonest, with the knee osteoarthritis as the leading problem. And therefore, you know, osteoarthritis of the knee is one of the commonest reasons why people go for surgery of the knees, and also of the hip. You know, these are the commonest surgical procedures in orthopedics that people undergo. And when you hear people calling for fundraising or going to India or something, usually they are going for hip replacement, knee replacement. But these surgical maneuvers can be done in this country quite reasonably and successfully, and they are available. The second one that I want us to throw a spotlight is rheumatoid arthritis, and this is the one that we deal with most of the time in our clinics, in rheumatology clinics. It affects about 1% of the general population. Disability starts early in the course of the disease, increasing with the duration. 10% of them are severely disabled. 6% have got mild to moderate disability. But I want you to note that 50% of patients with rheumatoid arthritis are unable to work after 10 years. But modern aggressive therapy has dramatically improved the outcomes. You know, over the last 20 years or 10 years, no, 20 years, we have had a lot of advancement in terms of treatment of rheumatoid arthritis, and we have got an avalanche of medications that have reduced the complications that we have been experiencing, the pain and the disability. And we have been able to reduce these 50% who are unable to work at 10 years to a significantly lower number. Right now, I'm looking at I'm doing a study on rheumatoid arthritis, look at what are the determinants of response to treatment. And what we are seeing is that most of the people who are continuing severe disease are, number one, are unable to afford medication because they cannot sustain medication in the long term because of the health systems or the health financing system and so forth. And therefore, they are unable to sustain. Of course, then there are those who, for one reason or another, due to lack of understanding and all that, are not on medication or stop medication, or because of revert to certain unproven remedies in the management of these conditions. Then there's one called gout. Gout is called the king of diseases and the diseases of kings. Why? Because is king of diseases because of the severity of pain that comes from gout. The pain comes with explosive suddenness, is very painful, and sometimes can be self-limiting, and commonly affect the first metatarsophalangeal joint, the big toe, and it is a king because it is the severest form of pain that are experienced by men. Women have got other reasons to have other severe pains, but this is the severest painful condition that men experience. But it is diseases of kings because it is usually comes from avaricious appetite and drinking habits. Kikulacho kingoni, what you eat, what eats you is in you and is caused by yourself, and it can become chronic. It can involve joints persistently and make you uncomfortable. The joints are stiff and swollen. Acute flares may still occur, and joint damage can occur. The other thing about gout is that this high uric acid can affect, be deposited in the kidneys and cause kidney failure, and can also, it comes together with diabetes, sometimes with high cholesterol, and therefore predisposes you to heart conditions and heart attack. But because it is also common in chronic alcoholics, they also have a liver problem. So when they get an infection such as pneumonia or something, they do not have enough in themselves to fight these conditions. And therefore something which just started from the habit of excessive ingestion of meat or uncontrolled imbibing of alcohol leads to mortality, which is absolutely unnecessary. So I'm coming to back pain. This is the most prevalent musculoskeletal disorder and is the second leading cause of sick leave in developed countries. Second, because the reason why most people go on sick leave in developed countries is because of influenza. And that's why there's an aggressive drive to have everybody on influenza vaccine. And I suggest that this is one of the areas that we need to work on. Have an aggressive influenza vaccination drive so that we reduce morbidity due to upper respiratory tract infection. But back pain is the leading cause of absenteeism from work, and accounts for 50% of restricted activity of days, and can be caused by many problems. It can be because of infection, such as TB, can become because of fracture, traumatic fracture, cancers, ankylosing spondylitis. Most cases can be non-specific muscles or some ligaments in the back. If you happen to be in Nairobi, you can pass through our office. There's a small book we have written, which is you can get from there, called Understanding Back Pain. It is so important that we have even produced a book so that people can understand it. And you can call my office and make your order from there. Then osteoporosis. Osteoporosis is fragile bones due to low calcium leading to fractures. It is commoner in women postmenopausal. In men, it can come at a fairly advanced age, and it causes fractures, especially of the neck or femur. These fractures come as a result of just stumbling. We call them fragility fractures because they come from trauma, which under normal circumstances should not cause fracture. Then there are also fractures, compression fractures of the spine. If you look at this spine here, you see some of the vertebrae are squashed. Those are fractures. You see somebody who was used to be 6 feet tall. Now the height is just reducing with age. That reduction in height is because of compression fractures. That stooping, there's nothing like old age. Everybody should age standing upright. But when you see people stooping, it's because they have either multiple compression fractures on the back, or they have severe arthritis on the back, compressing the nerves. So the comfortable position is that one of stooping. It's common in women over 50, and the risk of dying of hip fractures is equal to the risk of dying from breast cancer. Once you get fracture of the hip, that's why this issue is very important. That once you get the compression fracture, an old person, you are admitted. Remember, this is the same person with hypertension. This is the same person who is immunity is weak. He can die from blood clots. He can die from pneumonia. He can die from depression. Can die from anything. So the risk of dying when you get this compression, these fractures of the hip, is equivalent to the risk of dying from breast cancer. So you can see the importance of these musculoskeletal diseases. And I want to let you know that in the month of October is usually the worldwide arthritis month and spine month. And 12th of October is the World Arthritis Day. And they pass unnoticed. And breast cancer is celebrated, and everybody wears ribbons. It is time you also wear ribbons for something which causes as much mortality, but more morbidity than even breast cancer. Osteoporosis, common in over 50 years, and 30% of women above 50 years have got osteoporosis. Another 30% have got osteopenia, and only 30% are normal. And therefore, one needs to go for measurement, bone density measurement, to check where you are, so that your calcium supplement can be adjusted. And secondly, if you have a lifelong low calcium ingestion, you are putting yourself at risk of osteoporosis in the future. The tragic thing is that the instruments for measuring bone density are not that widespread. We only have them here in Nairobi, at Nairobi Hospital, at Aga Khan Hospital, and somewhere around the Parkland, around the MP Shah Hospital. So we do not have many of these DEXA scans which measure osteoporosis, and that is tragic for something which affects 30%, almost 60% of women population, and that is huge. What about infections? We can have joint infections due to bacteria, or we can have bone infection due to trauma and going to the bones. HIV infection may lead to bone and joint infection by unusual organism. Tuberculosis can also go to the bones and joints and cause infections. And these are some of the things that we need to be worried about. So there are many things that can affect the bones and the joints, and infections are also there. Then there are musculoskeletal occupational injuries. And this is a major cause of work loss. You can see in the picture there, a woman carrying heavy luggages. We know some in occupation, people are employed to ride around mkokoteni from here in Nairobi, from somewhere in Parklands up to wherever, or from Marikiti to Kiven Kangemi. And these people are just a disasters in waiting. Their future will be bleak because they're having back pain, shoulder pain, elbow pain, hand pain. They'll have pain. Some work we do now. So we need to look at better ways of doing things so that our future is comfortable. You can ruin your future by the way you are doing things now, and we don't have to continue doing things the way we used to do them. And then there's a musculoskeletal injuries due to trauma, and we are talking about road accidents, motorbike accidents, accidents in sports, and so forth. And you can see road traffic accidents are huge. It's a huge cause of injuries worldwide, and it causes issues. But why are we talking about it? I want us to look at this accident map in the world. You can see, if you look at it, most of the leading more than 40 per 1,000 road fatalities. The average in the world is 20 to 20.8. But if you look at this map, the leading areas, countries with the leading accident rates in the world is, you look at Egypt and Libya there, around there. In Africa, Algeria is the one which is least. I've gone there, they have got very good roads everywhere. But Kenya is among in the top. You can see Kenya here, Kenya, Tanzania, we are somewhere at the top. We are operating at 36.5 to 40. The accident rates in Kenya, road accident rates, are among the highest in the world. And therefore, this is something that should concern you when you buy a car and allow yourself to drive drunken, or you allow a teenager who is going to come back drunk to driving, causing death, harm to other people in the road or to themselves, or you allow a person who has your issue at the fake driving license, somebody is going to drive people. These are all the reasons, many reasons. Usually we clamp down on vehicles and stop them as a cause of accident, but the leading cause of accident is unroadworthy drivers. Unroadworthy drivers. I don't see how a vehicle which is very bad can cause an accident. It is just a nuisance even to the driver. But a nuisance driver, even with a new vehicle, is more dangerous than an old vehicle on the road. So we need to focus on the drivers, and we are there. We are there on the top of the map of the world. We are not just top on athletics, we are also top in road accidents in the world. We are operating at the very top. So what effect do musculoskeletal conditions have? Number one is pain, deformity. Many people are unable to do the work, their usual work, physical disability, and reduced quality of life. Because if you have pain and you are deformed, you cannot walk around, you have reduced quality of life. In fact, this deformity is so bad. Like, for example, in rheumatoid arthritis, your fingers can be so deformed that you are unable even to withdraw money from your ATM. You cannot even type on the computer. and you are just, it is very, very depressed, and the quality of life is reduced. So what is the cost of musculoskeletal conditions? Musculoskeletal conditions are very expensive to treat. They take a lot of money. The greater costs are indirect costs related to mobility and disability. It is not just the cost of buying medicine or the cost of paying for surgery. The cost can also be looked at. How many days have you missed going to work? What does it mean when you retire early? It means there's loss of income, there's loss of medical insurance, and many people who die after retirement die because they have no medical insurance, because they were able to get medicine for even hypertension or headache or something, but now they cannot sustain. And therefore, we need to look at this thing in a broader way. Number one, if we are in the industry of insuring people, like APA is, what package do we have for those who have retired, something they can afford to pay, something that keeps them well? And we need to develop those packages that even those, you should not say I'm only giving you health up to 60 years or 70. Are you saying that somebody above 80 years or 100 years does not need medical cover, or does not need medications, or does not need health cover? We need to start thinking in a broader way, because the number of people who are growing old are increasing, and they might be the majority in the community in the not distant future. And second, you who is exempting people will be old. Don't think that youth is not stagnant. You will be old. Just to digress a bit, there's a time when HIV was not covered by the insurance company. They said it's exclusion. But when the insurance executive started getting HIV, that's how it is covered now. And I'm suggesting that we are all going to get old. It is time we think about it. However, this government is also talking about universal health cover. And here again, we need to have everybody paying for NHIF or paid for NHIF, so that they are able to access some medical cover wherever they are, and wherever they are, and whatever quality they need. Because musculoskeletal conditions are coming. If they are not there with you, they are coming. Musculoskeletal conditions are the commonest cause of early retirement or long-term sick leave. And if you have anybody in your company who is on long-term sick leave, he or she has some musculoskeletal conditions. And the burden is increasing. Why? Aging of the population. People are living longer in all populations. Then there's change in lifestyle. You can see what choices here have got consequences, because you see some people here are just sedentary lifestyle, eating and drinking, eating pizza and watching TV. Another one is just smoking there. Others are engaged in eating of junk food. All these have got consequences. You know, sedentary lifestyle, obesity is one of the reasons associated with osteoarthritis of the knee, associated with gout. Smoking is associated with all sorts of arthritis, rheumatoid arthritis, osteoporosis, all that, and cancers, and anything. The eating of fast food junk food is also related to obesity, and obesity is one of the biggest problems. Obesity leads to hypertension, diabetes, cancers, arthritis, osteoarthritis, and name it. Name anything. So what about physical activity? There's a World Health Report which was given in 2002, and it reported that 17% of adults are physically inactive around the world. 17%. They just don't do anything. So, and 41% of adults take some but insufficient activity. So you are seeing that only about 40% of adults have got some physical activity. Over 60% are not 40, 2/3 have got insufficient activity, and a third are totally inactive. Physical activity is estimated to cause 1.9 million deaths globally annually. There are 2 million people dying every year in the world because of just not doing anything, sitting down, doing nothing, or maybe just ordering people around, sending people around, or just sitting, watching TV and eating and drinking. And these are unavoidable things. Then there is the issue of transportation. You know, when you go to a place like Holland, most people, even Norway, most people, including the president, are riding bikes. But here things have changed to here, this was taxi. From riding a motorbike is considered as a inferior and degrading activity. In Kenya, people have gone to taxi. The situation is worse now. This was the days of taxi. Now it is Uber, coming to pick you from your door and dropping you on the entrance of wherever you are going, and not knowing that you are just incubating death for yourself by being totally inactive. Instead of taking a ride in an Uber, sometimes you are given an opportunity to take a walk. Then lifestyle risk factors that lead us to arthritis are like diet low in calcium, diet low in vitamin D, malnutrition among the young and the elderly, alcohol consumption and smoking. And the greatest increase in consumption of alcohol and smoking is in the developing countries. And it is worse that this increase is among the females. Over the last 2 months alone, we have seen young girls in their 30s admitted to wards with liver cirrhosis, liver gone because of alcohol. Young girls, 30 something. And girls are the leading alcoholics now, even in this country, in terms of just drinking and smoking. But people are just quiet about it. You'll have no, especially the professional ones who are independent and just hanging around, eating their money, spending it on alcohol, bringing death to themselves early. Falls, injuries, accidents, we have mentioned them, road accidents. We need to continue working for better roads, road safety, because they are causing us problems in generally in the community. Then occupational, we have talked about occupational injuries. This method of plowing will cause problems for the backs of these women, the hands, and therefore we need to have embrace modern methods, better ways of doing things, which will preserve our health. But in the process, we must also provide alternative methods of exercising, provide avenues for exercise. When I was young, growing in the estates, we used to have football fields, walking places, and all that. But the current estates growing in urban areas, Nairobi, have got nowhere to walk, no playing field. Even many schools nowadays have no football pitch. You know, we used to identify schools by a football pitch, a running track area, and so forth. But these days, you just see a sign for showing you such a school. But there's even no opportunity for the kids to play. In the British system, when they were reviewing their curriculum, they created more time for physical activity. That then they come late, around 9 o'clock, and by 3 o'clock they're gone. But even within there was a law which was brought up that a certain percentage must be allocated for physical activity. While here, people learn excessive things. They learn the history of I don't know what, of Rhodesia and so forth. And even then, they don't learn any history of Kenya. And then there is the lesser The better schools are those which the children don't even read from 6 o'clock to 7 o'clock and given homework, which they do up to 1 o'clock, then again tomorrow 6 o'clock. There's no time for physical activity. We need to create time for physical activity. So what can be done to prevent and control musculoskeletal conditions? Number one, physical activity. Physical activity. If there's any invention that needs to be done in the world, is to take exercise, put in a capsule and give it to people. If you want to be healthy, you have to engage in physical activity because it will prevent arthritis, it will make you alert, it will prevent hypertension, diabetes, it will prevent cancer. This is the best deal you can give yourself, physical activity. Then ideal body weight. Have ideal body weight, balanced diet, including adequate consumption of calcium and vitamin D. Avoid smoking and avoid alcohol consumption. Prevent injury, and let's have a safe environment. Let us abhor potholes, bad roads. Let us abhor them. Let us applaud any efforts to improve infrastructure, as well as roads, because potholes, bad roads, unmarked roads, overspeeding, these are some of the things that cause accident. We need a safe environment. Manholes in the estates not covered, somebody comes and falls inside there, breaks the leg, goes to hospital for a year, or one surgery after another, because of unsafe environment. Improvement of activity, we are talking about stopping smoking, good diet, taking a ride with a bicycle, walking around, taking a walk, avoiding alcohol, and seeking treatment for diseases. How do we treat arthritis? Number one, treatment aims at pain control, restoring function, and disease management. And then lifestyle intervention, we talked about diet and physical activity. Medications as prescribed. Medications are specific for specific diseases. Surgery when you have fracture. Surgery when you have joint replacement. Then rehabilitation. Rehabilitation, a multidisciplinary rehabilitation which involves education on arthritis and self-help. As in the Oyoo Rheumatology Foundation, we run a course for patients. We used to run before COVID on self-management and use education for patients. And we encourage patients to form groups of various groups, arthritis, lupus, whatever, for self-efficacy, self-education, self-help, and how coping strategies, physical therapies, and therefore again, I have no problem, but most insurance companies do not value physical therapy as a mode of treatment, and they look, and sometimes this is the only thing that a patient needs. Walking aids and appliances. Sometimes they say, no, we are not going to buy for you a walking stick. We are not going to buy for you a wheelchair. But sometimes a walking stick will convert somebody who was unproductive to productive, will give them stability as they walk and prevent them from falling. We will make them go to work instead of sitting at home. It's important that we have comprehensive, but generally we need to develop rehabilitation centers as the population is aging. There are many people who are taken to hospital, going there, risking getting COVID and other infections, while what they need is just rehabilitation. If you go to countries like Hungary, you can go to big hospitals, and the only thing they do there is rehabilitation. Physiotherapy is the only thing in that building, and they have nice facilities. Imagine one or two hotels in the coast converted to a rehabilitation facility. And if you want a holiday, if you have a back pain, you go there, stay there. You are having a nice time in the beach, but also having intensive physiotherapy. After a week, you will go back to Kisumu, wherever you're coming from, well refreshed, both mentally and physically. And rehabilitation in most hospitals is stuck at this corner, poorly equipped, not even known. I have a lot of problems when I'm sending patients out, even when I'm working in Kisumu or Mombasa. I'm telling somebody, you stay in Malindi, go there for physiotherapy. Hakuna physiotherapy huko. And this is one of the major investments that needs to occur. I'm looking forward for an APS center of rehabilitation somewhere in the corner of Kisumu one of these days, or in Kwale, in Kwale, Msambweni. So what are the interventions that are effective? In osteoarthritis, we have pain control and self-management, exercise, and when the joint is completely damaged, we do joint prosthesis. In rheumatoid arthritis, education and self-management, we had a book on arthritis. It is out of print, but we are hoping that it will be, we get bring it back into publication, and then it will just be, you can also get it from us. Then effective disease-modifying therapy, and I've told you that this has really revolutionized the management of arthritis, and we hope that they will be able to afford, either because of the cover given to them by APA and other insurances, but also by through this universal healthcare. It is not just APA, even NHIF has also cover many of these conditions, the under exclusion, and it is very appalling that something which is reversible is under exclusion. Back pain, what we need is early rehabilitation. Early rehabilitation. Even when you're done surgery for the hip, you need rehabilitation. The poor outcome of surgical procedures is because of lack of adequate rehabilitation. And rehabilitation centers is one of the things that we need to work on. And osteoporosis and fractures, we have fracture prevention strategies for those at high risk. Somebody with osteoporosis, older people sometimes fall down because their eyesight is poor. They are not seeing the steps. That's why you see some places say, watch your step, is to prevent falls and fractures. And eyesight improvement is important. Improvement of hearing, because you can put that thing, watch your step, and this person you are telling, watch your step, the hearing is impaired. And we need to make sure that we cover. I've not seen any insurance company covering hearing aids, and that is sometimes is a life-saving gadget for the person who, because sometimes they will not hear a bicycle ringing the bell that toka kwa njia, then they are knocked by the bicycle, or they don't hear hooting, or they don't hear watch your step, or when somebody is telling me unaenda kuanguka, they cannot hear. But if they are hearing aids, they will still be alive. There are many people who would be alive if they had hearing aids, or if their eyesight was good. So what strategies can we develop as we come to the tail end of this our engagement? We need to identify those who are at highest risk, early and appropriate management of those with musculoskeletal conditions. If you have any joint pain, seek medical attention, go and seek attention at the most competent place. You get a diagnosis for your conditions, and then you are treated. Access to appropriate care for those with a musculoskeletal condition. Many people go for unproven remedies. They don't go for proper care and suffer damages because of negligence of their condition. What are the barriers to implementing strategies for better bone joint healthcare? One is lack of availability of services and resources. We've talked about the lack of rehabilitation, lack of rheumatology clinics, lack of rheumatologists, for example, few orthopedic services, few physiotherapists, inadequate access to services, national priorities. You see, like, for example, now in this country, it's cancer. There's nothing wrong with that. But we also have musculoskeletal diseases. We need to have physiotherapy area, every corner of the country should have rehabilitation services. No single rehabilitation services has been built by any county since the evolution started 10 years ago. So you see, these are some of the things. When you go for public hearing and approval of county budgets, what input are you putting there? What do you say? What do you tell your MCA? What do you tell your MP when you go for public participation? They should have proper priorities. The same way they were being told put beds for COVID, they should have for physiotherapy, for rheumatology follow-up and so forth. And we need to, other barriers, lack of awareness about the burden of musculoskeletal conditions and what can be achieved by the prevention and treatment, and by policymakers, healthcare workers, and the public. I've told you that these are the leading causes of pain, leading cause of absenteeism, leading cause of early retirement, and they are serious. It's a serious business. Back pain, osteoarthritis, and this is the message that I want you to have. When WHO put aside born and joint decades, they started 2000 to 2010, then 2010, 2011 to 2020. But we are still in the born and joint decade. So now we have renamed ourselves as Global Alliance for Musculoskeletal Diseases. And our aim is to raise awareness for the suffering and cost to society associated with musculoskeletal disorders, empower patients to participate in their own care, promote cost-effective prevention and treatment, advance understanding of musculoskeletal disorders, and improve prevention and treatment through research. And we need to gain priority and resources through advocacy with evidence. That's why I'm hoping that the medical cover of APA will be changed and they'll give priority to musculoskeletal diseases, especially in terms of rehabilitation, in terms of prevention, in terms of offering surgical things. So knee replacements can change somebody from an invalid to an active person in the society, and will continue providing services in the country. Joint diseases, back pain, osteoporosis, limb trauma due to accidents, and armed conflict have an enormous impact on the individual, on society, on healthcare and social systems. With the increasing number of older people and changes in lifestyle occurring throughout the world, this trend will increase dramatically over the next decade and beyond. And we must act on them now. This was said by Kofi Annan in 1999, and I'm saying it again in 2022. We must act on them now. You choose her, and thank you very much for your attention. I think nita stop there kwa sababu nimeongea sana. Asanteni sana.
Thank you, Prof, for that. Na haujaongea sana. It was actually light being shared to us. On Q&A, we have some questions. Mary, maybe you can be able to see, or I can read them for you.
See them. Mary is asking, after how long taking methotrexate should pain reduce on a joint in case of rheumatoid arthritis? Methotrexate are, there are many cases. There are many cases of, there are many causes of pain in arthritis. And there's those are due to disease activity, there are those due to joint damage and all that. So it depends on what is causing the pain. But methotrexate, they're usually slow-acting drugs. There are many ways of measuring how they work. We use disease activity measurements. So you may have pain even when the disease has been controlled. Pain can be due to joint secondary osteoarthritis. Pain can be due to what we call fibromyalgia coming in, and therefore the actual cause of pain need to be identified and be managed. But methotrexate is considered not to be working if it is measured properly in the right dosages after a period of 3 months of 3 months. Then this one I think is a comment. Okay, I don't know how it's coming down. Thank you very much.
Prof, there's a question. If for how long can one do a physiotherapy, and after how long should one have it so that it can ease the arthritis symptoms?
Physiotherapy, let me start by saying there's no overdosage of physiotherapy. So one of the reasons why you go for physiotherapy is to be taught some exercises which you can do at home. You are not supposed to go there and just stay there. So there's no overdosage. You can do it forever. It should be part of it's part of your should be part of your life, just doing physiotherapy. And how long it causes to reduce pain, it depends on what kind of pain you are dealing with and so forth. But usually, if after 5 sessions, usually we should see some level of improvement. Or if you are doing it and you're feeling that it is not helping you, you need to abandon it and go for re-evaluation, and maybe sometimes you feel that it is injuring you. You need to stop, go for re-evaluation, and then an alternative will be found. But once, even the first session of physiotherapy should be able to tell you whether you are going to benefit from it or not. Thank you. But there's no overdosage if it is working. It's something you should do for every day for the rest of your life.
Thank you for that, Prof. There's another question about cholesterol. You mentioned about gout being related to high cholesterol levels. There is medication. There is medication to bring the cholesterol. Yeah.
Yes, there are medications, very many medications to reduce cholesterol. There's also lifestyle nutritional advice that can help you maintain recommended levels. And when you're talking about gout, gout is one of the conditions that will be considered curable in arthritis, because you are able, if somebody develops good diet, adapts good diet, and takes medication to lower the uric acid levels, and somebody is able to maintain normal uric acid levels and stay free of gout attack. Somebody asking, muscle cramps, can it be a sign of arthritis? Muscle cramps can be caused by many things: low vitamin E, low calcium, just being unfit, and therefore the best is to be evaluated. It may or may not be related to arthritis, may not even be a sign of arthritis. It may just be a sign that your calcium is low, or there's something not working in you. Maybe you are just unfit and you need to get to the fitness level. Then there's another question here. Oh, lifestyle changes. Lifestyle changes that we should adopt is, I've talked about physical exercise, stop smoking, stop drinking, and take a lot of vegetables and fruits, take a lot of water. In fact, cigarette smoking, if you're genetically predisposed, there's a study called the twin study, which was done in Manchester, and they took two groups of people, identical twins, those with the genes for gout, for rheumatoid arthritis. There are those on normal diet and those on vegetarian diet. What was found was as follows: the ones with vegetarian diet develop arthritis later, and even when it came, it was mild. These ones developed it earlier. So lifestyle, diet change can influence even the expression. You can postpone even a disease. You can postpone your death by what you eat. You can even bring forward your death. You can bring forward your death by what you eat. In fact, when you open your mouth in your dining room to eat, you are making a very important decision regarding your future. Your future in this world is more dependent from what you eat and drink than even from the amount of insurance you have taken from APA. The insurance you have taken from APA will mean nothing if you are just eating and drinking carelessly. Thank you. So this lifestyle, exercise, diet, and all that are helpful. Also, why does level of pain increase during cold? It's just because of the physiology. Pain receptors are more sensitive in cold weather, and therefore you feel more pain. It's not that arthritis is commoner in cold weather, but the pain sensation is more enhanced. Is arthritis hereditary? To some extent, yes. There are genes that make code for arthritis, but the environment, like you can have the same genes if somebody is smoking, another one is not smoking, another one will. Environment influences the expression and expression, but their genes, yes. It does not mean that if your mother has arthritis, you get arthritis, but your chances of getting are higher than somebody whose mother doesn't have. In fact, 25 times higher. And the twins, when one twin has arthritis, identical twins, the chances are even higher. Non-identical twins, the chances are lower, but they're higher than in the general population. Then the issue of can jogging cause reduction in cartilage and eventual pain? No, yes, what jogging does, good exercise, you should be assessed first. You know, the kind of exercise you do in the gym and also depends on your health. And what jogging does, it strengthens the soft tissues around the joints and therefore strengthens the muscles, the soft tissue around the joints, and makes the joints more stable. In fact, even when you are planning to go for surgery, when you are planned for surgery, you should always go there when you are fit, because the outcome of surgery depends on your fitness before the surgery. The surgery does not make you fit. You should be fit as you go for surgery so that your outcome is good. Do supplements help in arthritis? This is a big topic, and it is a big topic. And I can say yes and no. The studies are conflicting in many ways, but it depends on which supplement. Calcium supplement is indeed helpful, and some insurance companies don't cover calcium supplement, but I want to tell them that sometimes this is the medication that a patient needs. For example, if you're having osteoporosis, your treatment is calcium, and therefore calcium, vitamin D, and that's the treatment that the patient needs. So if a prescription is made, don't say I'm going to cover 1, 2, number 4, nimewacha, hiyo ni yako, sijui nini. The patient does not write prescription. Prescription is written by the doctor. So some supplements are helpful. There are others which are still under investigation, or investigation brought in and brought out at various. Which hospital can you prevent? At the moment, we do not have adequate rheumatologists. But let me say that we have sufficient training for our physicians in Kenya to be able to manage arthritis. But we have a rheumatology clinic at Kenyatta National Hospital. We have a rheumatology clinic at the Mater Hospital. We have a rheumatology clinic running at Aga Khan Hospital in Nairobi, Aga Khan Hospital in Kisumu, at the Mombasa Hospital, and we have a rheumatology clinic at Nairobi Hospital, and we have a rheumatologist based at Jaramogi Oginga Odinga Teaching and Referral Hospital in Kisumu, and at the Moi Teaching and Referral Hospital in Eldoret. Those are where we have rheumatologists. But our aim with your support and the support of others is that we will have rheumatologists in all the county hospitals in the country. And that is my aim. That's my contribution. that I want to make to the society. But I walk around in the countries, teaching in the counties, teaching young doctors how to recognize managing rheumatologic emergencies and make referrals. And I would seek the support of APA to fund that our project for teaching people on early recognition, management of rheumatoid arthritis everywhere in the country. I hope I've answered. What happens with osteoarthritis? Let me go and see what the question is saying. What happens when you have osteoarthritis? Does it mean that ligaments do not degenerate and surgery is necessary? The cartilages are destroyed, the joint fails because the cartilage are destroyed, the ligaments are destroyed, and therefore they have to be replaced. But the reason for replacement is not the disability. Reason for replacement is if you have so much pain that you are unable to sleep and are unable to carry out activities of daily living. It's not even the amount of cartilage. Yeah. In my earlier presentation, I'd put in arthritis in children. Yes, I just changed it this morning. I removed the children bit so that I put emphasis. But yes, arthritis affects children. We have the juvenile idiopathic arthritis, and there are 7 types of arthritis that affect children, and they can be as severe, and they need to be early recognition to prevent damage to the children and even to prevent mortality. Does intake of milk and milk products increase the pain in case of rheumatoid arthritis? The answer is no. But if you take an unpasteurized milk, sometimes you can get brucellosis, which can also manifest arthritis. I've talked about the genetic, the inheritance and the genetic of arthritis, and the answer, there's some genetic which influences the expression of arthritis and the expression and severity of arthritis. Then the question of how does treatment, the steroids are a cornerstone of management of arthritis in the sense that it can be used. It is used to especially in certain emergencies in diseases like lupus, vascular diseases, and also is a bridging treatment in rheumatoid arthritis, because the aim of arthritis is to stop the pain as soon as possible and as long as possible. Stopping pain as soon as possible is with steroids. But we hope that by the time because the other disease-modifying drugs take time to work, by the time they start working, you reduce the steroids to 0, because steroids are associated with osteoporosis, hypertension, diabetes, and psychosis, name it. They have got so many side effects that you should not depend on. But unfortunately, people are just given steroids everywhere in this country, just like that. But again, in rheumatoid arthritis, we now have biologic agents which are a bit costly, but can reduce the pain of arthritis as soon as possible. And unfortunately, many people don't cover it. The same drugs, some of them are used for treatment of cancer and are well covered by even NHIF and other insurance companies. But when I want to use those drugs for arthritis, where they'll even have a better impact on patient outcome, nobody wants to pay for them. And I think we need to have a comprehensive cover that covers all sorts of treatments, early available treatment that can be offered to a patient. Can you explain gout attack? My gout attack is just sudden pain that comes because of an upsurge of uric acid. It can come when you have just had a binge of alcohol, or when you have taken a lot of a certain nyama choma or something, you get a gout attack. Knee subluxation is the best remedy is physiotherapy and maybe surgery. Rheumatoid arthritis can affect the neck and cause many problems around the neck and the chest, but also in the lungs. It can cause fibrosis, can affect any organ. But effect on the neck and the nerves around the neck is very known. One is asking, can calcium can lack of calcium or pregnant mothers cause paralysis calcium is important to have it adequately in many people and can cause many problems. You know, calcium is important in nerve conduction, and lack of it can cause many problems. Lupus is a cause of arthritis, just like rheumatoid arthritis, but lupus can affect any organ, can affect the hair, can affect the skin, can affect the lungs, can affect the kidneys. That affect the kidney, can affect the blood vessels, the intestines. It affects more. Doesn't cause as much joint damage as rheumatoid arthritis, but causes severe joint pain. They are similar, but different. I was not talking about it because we just had the World Lupus Day on the 10th of May, and we had a live webinar on that. So that's why I did not put any spotlight on lupus, but it's one of the things that at some point we can come back and talk about it. You can never finish talking about arthritis. You can never. It's one of these things we keep on. In fact, even next week, we are moving to the European Conference of Rheumatology just to talk about some aspects of arthritis. What are the ranges of bone density? Bone density is osteoporosis is diagnosis in bone density, and zero. The principle is that it is assumed that a young lady of 30 years, that is the standard and the benchmark with which you measure the bone density. So your bone will be compared with that one of a 30-year-old person, either at the hip or the wrist or the back. And therefore, if you are 0 to -1, that is normal. -1 going to -2 is osteopenia. Anything -2.5 going upward is osteoporosis. And -4 going upward is severe osteoporosis. But even if you have -2 or 2.0 or -3, and you have got a fragility fracture, that makes you severe osteoporosis. So 0 to -1, we don't do anything. Osteopenia, you should be on calcium supplements. When you are -2.5 going upward, you should be on bone strengthening medications. What are the best calcium supplements? Number one, the best medicine is that one which is taken by the patient. No medicine works when it is not taken. One of the biggest problems I have is that people don't take medicine. But basically, we need best calcium medicine is the one which can supply you with the mental calcium of about 1 gram, 1 to 1.5 gram every day. You should get 1 to 1.5 gram every day. And that is the best. But the best medicine is that one which is taken. You can carry the best medicine in your pocket, but it will not help you if you don't take it. Is there remission in these therapies and management and this lifelong? Yeah, remission is there. Always when you start treatment of rheumatoid arthritis, remission is the goal. And that's why I'm doing a study on rheumatoid arthritis to determine why we have been treating patients since we started our rheumatoid arthritis clinic in 2002 at Kenyatta National also. But we have not been able to reduce the rate of remission. What is going on? And we'll see what is going on. Most people are not taking their drugs. Most people cannot afford drugs. Most people, when they take and feel well, they stop, then they'll come back later. Those kind of things. We'll see. Is it lifestyle? Is it what? But remission can be achieved. Their patients have achieved lifelong remission, even with rheumatoid. Yeah, gout arthritis is something which you can be cured. When you stop drinking, you take your medication, you reduce engage in exercise, it is curable. Are there home remedies? Home remedies are things like you keep cold compression with ice compression, get some pain medication, but the best thing is to rush to the doctor and help. You'll get help so that you can have a normal uric acid and prevent. Arthritis and nerve pains can be occur. You know, when, for example, you have long-term rheumatoid arthritis, you will develop nerve problems. You'll get what we call peripheral neuropathy because of the effects on the blood vessels and so forth. When you have back pain, you can, the disc can press the nerves and you have a problem. You have back pain, but you also have nerve pain radiating to the legs because a problem of the arthritis you have at the back. But arthritis also affects the blood vessels, and you can develop what we call the blood supply to the blood vessels, to the nerves will be decreased, and therefore you get tingling, numbness due to initially because of arthritis, but now. Yes, rheumatoid arthritis as a drug, it is arthritis that comes as a result of the body developing antibodies which are fighting themselves. Then the complex is deposited on the joints. We have drugs that prevent that kind of interaction in the body, and it can be treated. We have so many drugs that can be treated. My hope is that we shall eventually overcome and annihilate arthritis in all its form. And I thank APA Insurance. I've been associated with them for a long time as Apollo and all that. And thank you for this. I hope that they also are related with Apollo Hospital somewhere, but I doubt. So that one day there'll be a hospital where people can go the way AAR has done, built a hospital. So I don't know whether that's not a conflict, but that's how it is. So I got an injury from playing basketball on my left knee. You know, when you have joint pain, I was just teaching my students yesterday, the most important thing is to see, is the pain articular or non-articular? What is the source of the pain? And this is the crux of the matter when you are evaluating. If you got an injury playing basketball and left knee back to, and I did multiple tests and screening X-ray, name a few, and Nairobi Hospital for examination, then nothing was found, but I still feel pain. That means that the source of the pain itself has not yet been identified. It may not be in the joint, it might be somewhere, maybe in the spine or around the joint or somewhere. The source has not been found. Once the source has been found, you will just lead a normal life. Yeah, because MRI should be able to pick any problem in the joint. But yeah, but once the source has not been found, there are many causes of pain other than the ones we know. Asanteni sana.
Thank you very much, Professor Omondi Oyoo, for tackling all those questions and taking time to, be able to give a detailed response to our clients and to our listeners as well. Yes, Apollo is one of our relatives. Just to respond to that, and also I want to affirm that we do cover arthritis. Yes, and I know this is a discussion that cannot end today. There are many questions coming in. We will be able to respond to our audience via the emails. We'll be able to pick up the questions, and Prof, of course, will be able to respond to them. So at this juncture, I would want to give Valerie a chance to give a vote of thanks for the presentation. And again, thank you, Prof.
Thank you, Justus. Okay, thank you also, Prof, for the very insightful session. We really enjoyed. Thank you. Also, I would also like to thank the member participant who voted on. Thank you. I will also not forget the APA management team who have also made this session successful. I think, Prof, you could also maybe tell us your location and contacts, how we can reach you.
Well, okay. I run 4 rheumatology clinics in this country. The first one is at the Mombasa Hospital. It runs every 2 months at the Mombasa Hospital. If you call Mombasa Hospital, they can book you there on the second Sunday of the month. The second one is in the city of Kisumu at the Aga Khan Hospital in Kisumu, and we do a rheumatology clinic there. Once every month, the last Sunday of the month, like this coming Sunday, will be there. Then at the Mater Hospital, I do a clinic there on every Wednesday. Every Wednesday, we have a clinic there. Then at Kenyatta National Hospital, we have 2 rheumatology clinics, one on Tuesday and one on Thursday afternoon. Tuesday afternoon and Thursday afternoon every week. Finally, at the 40 Suites, at Hospital Road, 40 Suites, opposite Nairobi Club, is where I operate. Is where I operate from, at the Nairobi Arthritis Clinic, just on first floor, room number 10, at the 40s Clinic. The inquiry number is 0727 935706. That is the Nairobi Arthritis Clinic, but you can always get me in the Nairobi Arthritis Clinic, Mata Hospital, Kenyatta National Hospital, Mombasa Hospital for those at the coast, and the city of Kisumu, where I call it Operation Reach Back, because they are the people who brought me back up. I need to give back to them. Thank you.
Thank you, Prof. Our audience, I think they have gotten where to locate you. So without taking much more time, of course, there are many questions, but we cannot, because of respect to time, we cannot be able to proceed. So at this juncture, we would like to appreciate you for joining in, taking time to, have this moment and learning together, as Prof has guided us on this talk. Thank you very much, and we wish you a very good day ahead, and let it be known that we do cover arthritis. Thank you, Prof. Thank you very much. Of course, we'll come to see you, and we wish you the very best in the days ahead. Thank you.
Thank you very much.
Prof.
Yeah.
I know you also do write books. You can tell us where you can get your books.
At what?
The books of your.
There's a book on back pain.
Yes.
It is available at the Nairobi Arthritis Clinic. The cost is 1,000 shillings.
Thank you. Thank you, everyone. Have a nice day.
Thank you very much.